Nowadays, in my practice, I come across many youngsters who are losing teeth at a very rapid pace. I found it worrying. So the problem is they lack confidence at a very young age. So losing teeth at a very young age might have a huge impact on their confidence, on their socializing skills, and sometimes might be worrying for the nutrition itself. So I'm here to discuss about the various types of dental implants and how we can help them out. So let's talk about endosteal implants, which are very favorable implants, very widely done all across the globe. So these implants are placed in the jawbone, where the jawbone has a good height and width. So comes to subperiosteal implants. These implants are done in patients who have lost their bone due to carcinoma, cancer, or some other trauma or some accident or some other issue. These also can be done in patients who have lost their teeth at a very young age also. These implants are usually placed on the front surface of the facial bones. Now comes to zygomatic implants. These implants are done in cases where there is zero or nil bone in the jaw as well as the facial bones. These implants provide a very sustainable and long-term teeth to patients who have lost teeth at a very early stage. As low as 4 implants, 2 on each zygomatic arch, can help us to restore all the teeth on the upper jaw. Coming to the mandible or the lower jaw, for patients or the youngsters who have lost their teeth due to gingivitis or periodontitis or any other issue, there is something known as nerve lateralization, wherein we reposition the nerve. In that way, we gain the height so that we can place a very good size for a dental implant and hereby restoring the teeth. The one implant that I can also talk about today is strategic implants. These implants are single piece implants wherein the teeth connection that has to come onto the implant is soldered or welded onto the implant itself. So what these implants do, these are very thin implants that are anchored onto your jawbone. So these are placed in multiple numbers and can also be used to give you immediate teeth. Whether endosteal implants, subperiosteal implants or zygomatic implants, if they are properly torqued and a good support is anchored with these implants, we can also restore them within 72 hours. So that means we can also give you fixed teeth in 72 hours, and that will be a screw fixed teeth. So these teeth that can be fixed are of two types basically. So they are cement retained and screw retained. Cement is the one where we have a cement and the teeth can be fixed with the cement. The disadvantage with cement is it cannot be removed at will. So there is no maintenance that can be done. For a screw retained teeth, it is fixed with the help of small screws. So they can be regularly retrieved and regularly cleaned. So there are multiple materials that we can use. There is ceramic, there is zirconium. Depending on the facial height you have, we can decide what kind of crowns we have to get. There is one more thing known as sinus lift. In cases of patients who are not willing to go for zygomatic implants or subperiosteal implants and still want to get their teeth replaced, whatever the sinus enlargement or sinus have moved inferiorly, we can lift it by a special sinus lift procedure and put some artificial bone and mix it with patient's PRP. It is nothing but patient's own blood. We can regenerate bone and then wait for 6 to 8 months and then place the implant into that bone. So that also can be done.